welcome to this month's episode of Picture of Health. I'm your host, Lauren Lengyel. United Way of Central Florida affects the lives of Polk County residents on a daily basis. Their various programs focus on improving the education, income, and health of our community. On this episode of Picture of Health, I'm sitting down with Penny Borgia, the Chief Operating Officer of United Way of Central Florida, and Joy Johnson, the Director of Indigent Healthcare in Polk County. Ladies, welcome. Thank you so much for being here.
Thank you for having us.
Thank you.
So Penny, as the Chief Operating Officer of United Way of Central Florida, I kind of feel like you've got a lot of work to do.
There are always more needs in the community than we can address, but we do our best to address those critical needs and really make a measurable and sustainable difference.
I would love for you to tell me a little bit about United Way in terms of, while it is a widespread organization and many people have heard of it, there are still some that aren't sure exactly how you would describe it. So tell us about it.
Well, thank you. United Way is sometimes thought of as an airline. We're not an airline. We are an impact organization. I think some people think of us as a fundraiser, and it's certainly important that we raise funds. The 2015 campaign raised more money than we have ever raised before at $9,081,000. A lot of money.
That's a lot of money.
It's a very generous community, and we're grateful for them. But we haven't met our goal. When that campaign goal is met, we don't meet our goal until we have made an impact in the lives of children who are working to enter school ready to succeed and graduate on time, until we've helped low-income families to find and maintain financial stability, and until we've improved the condition-specific health indicators of folks that are accessing or trying to access a medical home. Those are our three primary areas with education, income, and health.
We're going to get more specific with the United Way program, but as you're saying that, and I'm sitting here with the Director of Indigent Healthcare, your missions sort of are very much on the same page, especially with improving health in the community. Is there any commonalities or overlap in indigent healthcare and United Way? Are you all working together on anything special?
There is an overlap. We do partner with United Way. In fact, we do work with them and administer FEMA dollars through the Federal Emergency Management Agency for emergency food and shelter. So for people who are low income and who need assistance with getting food, getting shelter, or other needs, as long as the funds are available, we can help make sure that those who qualify can actually get the services that they need in those emergencies. So that's one example of one way that we do work with United Way. There's many others. We do sometimes serve or work with some of the same providers that work with United Way, and we try to make sure that there's efficient services through the indigent healthcare funds.
United Way, the way that you're not only a fundraising organization, but you do administer funds. Can you tell us a little bit about that process and who's eligible for those funds?
We love to increase awareness about how that process works. It's really a multifaceted process. The first step is to identify community needs. Our mission statement is to understand community need, drive the change that will address those needs, and improve lives. And when you improve enough lives, you really strengthen the community. You make it better for everyone. So in the area of education, income, health, and safety net, we have steering teams that look every year at what are the critical conditions in this community, where are the needs the greatest, and where are those needs that donor dollars could make a measurable and sustainable change. And the people that help us do that are called our steering teams, impact steering teams. Joy is actually the chair of our health steering team, the health impact steering team. And those are experts in the area, in Joy's circumstance on health. So we have doctors, nurses, Dr. Joy Jackson is also on that team as the head of the health steering team. As the head of the health department. So those are looking at what are the most critical needs in Polk County, how can we prioritize them, and how can we then fund those programs that are using Indicators and measurements that are reliable and valid. They can't come up with their own surveys. In health, they have to show us a change in specific condition health of the patients they serve. They have to show us they've helped to reduce the number of emergency room visits or institutionalized care somebody would require without those services.
So this, forgive me, I'm going to butcher it, the health steering
team.
Those are the people that are making the decisions and looking at data to determine what programs should be funded.
We work in partnership with like the county health assessment plan, so we don't have to start from ground zero. We don't want to reinvent the wheel. Part of what the United Way does is to help facilitate services that are existing so that our partners don't duplicate services, and we can take that donor dollar and stretch it to do as much good as we possibly can.
Absolutely, you definitely don't want to duplicate services, waste taxpayer dollars or donor dollars, because that is, you got to be good stewards of that money. You have great responsibility.
Exactly.
So within those steering teams, is it just kind of like they're looking at the community assessment survey, and do you pull in other data from other sources?
Yes. All of our partners have to provide data to us as well. So the steering teams look at all of the outcomes and the indicators. And every partner, whether it's in education, income, or health, and even including safety net, the short-term crisis programs, they can only use indicators that have been approved by the experts on the steering teams. And so we train the partner programs as they're applying for funding, that we will purchase services from them if they meet the standard. And the people on the steering teams also train our community investment teams. So we have 136 volunteers on 14 teams in Polk County that 12 in Polk and 2 in Highlands County, that are going out and looking at all of the partner programs. And the steering teams show them what to look for so that they know what are valid and reliable measurements to show that blood pressures have improved or that blood sugars have improved, or how are they counting the number of days that were in the hospital before and after our funded service was offered to that patient.
So almost in a way making sure that the community investment teams are comparing apples to apples.
Exactly.
And that these outcome measures are actually feasible and things like that. And so then you have the pleasure of offering your feedback.
Joy represents the health programs, but there is someone from the education, income, and safety net programs as well. So then when we start saying, all right, we have just shy of $6 million in an allocation pool, where is it going to be addressed? Where are the most significant needs? Where can the best results be funded?
And approximately how many partner agencies do you all have?
We purchase services from 105 partner programs that represent 61 different agencies. But our partnerships involve more than just the funding. We also partner with the health departments and the hospitals and the Polk County school systems that help us to determine where the needs are. Sometimes it's where they're needed geographically, and sometimes it's topically, what kinds of services are needed. And they might be met close to completely in one area of the county, but there may be a significant need in another area of the county. So we're trying to balance all of those opportunities.
The first time I heard that you all actually partnered with the school board and with Polk County Indigent Healthcare, I was a little surprised because my background comes from the nonprofit side, and I never knew that those relationships had been forged. And like you were saying earlier, that your work isn't done until the community's actually healthier and better off.
Exactly. And that includes business partners too, and faith-based government agencies, some of whom the previous chair of the health steering team just prior to Joy was Bruce Abels, who's a strong community leader and a successful businessman in Polk County. But we want that business expertise as well to help prioritize and plan and identify where we can be more effective and more efficient.
How can people get involved if they want to be a part of a community investment team, or I assume that you have to be invited to be on the steering team, but how does that work?
They just need to contact us at the United Way of Central Florida. They can contact me, Penny Borgia, 648-1500. My extension is 275. And we can, if you have expertise and would like to contribute to some of the priorities of the services that we're going to fund in education, income, health, or in the very diverse services in Safety Net, give us a call. If you'd like to participate on the community investment teams, we'd be happy to have you there as well. And those people represent diverse groups in the community. On the community investment teams, that those people do not necessarily have, we try to get at least one expert or somebody with experience in their area on each team. But those people are broadly diverse members of the lay community, leaderships, mostly mid and upper level management folks in the community. And they are reading a 15 to 20 page application submitted by people who apply for funding to us. Then they have a Q&A opportunity where they submit questions for clarification in writing, get questions in writing back from the applicants, and then they visit each and every program for site visits, and they meet with the CEO, the program directors, clients, and board members from each of those programs. So it is a really thorough vetting of the programs and what they're offering. Are they using the approved curriculums, the approved assessment tools that the community investment or that the steering teams have identified as reliable and valid? If they're not, they're going to get dinged.
Well, on that note, let's take a break. Let's check out Whitney Fung's Healthy Eating Tip of the Month.
Hi, I'm Whitney Fung with the University of Florida ICE Extension and Indigent Healthcare. Welcome back on some tips for healthy eating. So today we're going to be talking about whole grains. And we talked a lot about My Plate already, and we have that balanced meal. And so a quarter of your plate should be grains. And grains are your breads, your rice, your cereals, your pastas. And the dietary guidelines are recommending now to make half your grains whole grains. And so what are whole grains? If you've heard of Cheerios or 100% whole wheat bread or 100% whole wheat pasta or brown rice, those are examples of whole grains. And the difference is that there are also refined grains. So instead of that whole wheat bread, you have white bread. Or instead of the brown rice, you have white bread. And so you want to focus on eating more whole grains because there's a lot of benefits for eating foods with high fiber. And so if you've heard of Cheerios will lower your cholesterol or oatmeal will lower your cholesterol, it's because of that fiber. And if you think of fiber, it's very good for our digestive system because you can think of it kind of like a sponge. If you consume those foods, it kind of cleans out your arteries and it lowers the cholesterol and it just goes around like a sponge pretty much. And so you want to focus more on eating whole grains. So what really makes up that whole grain? And so here we have a kernel of wheat. And it's the anatomy of a grain really. So if you think about any type of grain or even a seed, so think about a sunflower seed. And so you have a kernel here. You have that outside shell. That's called the bran. That's the outside shell. Then you have the endosperm. That's that white starchy part. And then you have the yellow part. That's called the germ. That's where all the nutrients are. And so the difference between a refined grain and a whole grain is that the whole grain has all those three parts still intact. So if you were to eat a wheat bread or whatever whole grain you're consuming, it might be a little bit rough. That's because the grains are still there. You could still taste that seed and still feel the texture of it. Whereas a refined grain, during the milling process, they strip that bran and they strip the germ, and all that's left is the endosperm, that white starchy part. So if you think of like a white bread, you can kind of roll it in a ball because all that's left is that white starchy part. And then they have to add back the nutrients of what they took out. That's why you might see enriched white flour sometimes on an ingredient list. So there's a couple of ways to make sure you're consuming whole grains. One is by looking to see if that package has 100%. So you want to see the numbers 100% on the package. Second is you want to make sure the word whole is there because that means that whole grain is still there. Now third is by looking at the ingredient list. It's not always guaranteed, but if you look on an ingredient list, the first couple of items are the most by volume of that product. So that means that at the end of that ingredient list, it's the lowest of whatever that product's made of. So if that first ingredient says enriched white flour, even though the item says wheat bread, it's not a whole grain. So you want to make sure it says 100% whole wheat flour or whole wheat bread. So make sure you check those things. There's also one other way that you can check, and I have Bethany Tate here, who is a Kaiser University dietetic student, to share that with you.
Hi, Whitney.
Hi.
Yeah, you've shared some great tips on looking for whole grain foods in the grocery store, but I'm going to share one other secret that not many people know about. You can look for the whole grain stamp. There are actually two kinds of whole grain stamps. The basic stamp means that there are at least 8 grams or more of whole grains in one serving of the food. So you might see this on some cereals, granola bars, or crackers. Or you can look for the 100% whole grain stamp, which is really the gold standard for whole grains. And this means that all of the ingredients in that food are 100% whole grain based. So this could be 100% whole wheat bread, or crackers, or flour, or even oatmeal. Another great feature of the stamp is it does remind you to eat the recommended minimum of 48 grams of whole grains every day.
Thank you, Bethany. Exactly, so make sure you remember how to check for whole grains, and don't forget, when you consume more fiber and when you consume whole grains that you're not used to, make sure to stay hydrated, because like a sponge, it also needs that water as well. That's all we have for you today. Thank you, and we'll see you next time.
For more information on this tip or any of the other 10 tips to a great plate, visit choosemyplate.gov.
Welcome back to Picture of Health. I'm your host, Lauren Lengyel. And in case you're just tuning in, we have 2 special guests in our studio today, Penny Borgia and Joy Johnson. So we were talking about many of the things that United Way has to offer. One of the other things that I don't think we've touched on yet is our information resource line, our 211. Can you tell me a little bit about that?
211 is an information and referral. I think there are over 7,000 services in our database. It goes well beyond just the partner programs that we work with on a routine basis. And you just dial 211. Sometimes people will say, how do I call 211? You pick up the phone and hit 211. That's all there is to it. And someone will answer that phone call, and you can ask whatever questions you have. If you have a senior citizen coming to live with you for the winter and you need a shower chair, whatever the need may be for childcare, job assistance, any of the kinds of things, they will help you to get to the programs in Polk County and Hardy and Highlands counties that can help you with that need.
Now, is that a 24-hour?
24-hour a day, 7 days a week.
Okay. So that's a hot line. Somebody will pick it up. So we talked a little bit about the programs that you funded and the 104, excuse me, the 105. Don't want to get anybody upset.
Yeah.
And the wonderful organizations that support them. But I understand that those organizations not only are funded in part by United Way funds, but also with indigent healthcare funds. Can you speak to that a little bit?
We've purchased services for a particular population, sometimes in particular geographic areas, sometimes by specific age group or specific need. Like we fund services for seniors, but they have to be fragile seniors that would not be able to live independently in their homes without the services that we fund through our partner programs.
The Indigent Healthcare Program is also in your referral database. So we will receive referrals from folks who need some level of health care. And what we will do is we will screen them for the Polk Healthcare Plan based on the eligibility criteria. And for those people who may not qualify because they may be over the income guidelines or have too many assets, we will screen them for other programs and services that are funded through the indigent healthcare tax. So some of those may not be funded through United Way. So that's the advantage of us working together with United Way, because they will send the people over to us. We will get them set up, get their information, and try to look at the Polk Healthcare Plan first and foremost because of the coordinated services that they would have access to. But depending on where they live, depending on their other criteria, they may need to simply go to a free clinic, for example, if they don't qualify for the plan. A free clinic, they can be up to 200% of the federal poverty guideline. So if they're over the Polk healthcare plan criteria, we try to make sure that we secure other avenues in the safety net healthcare system so that they don't fall through the cracks and they do get their needs met. So that's one of the ways that that collaboration and that partnership is very important, because that we have to get the handoff some way. So that's our method.
Citizens can use 211 both online or by placing the phone call. They can go to our website, uwcf.org, and look, need help, and click and go through keywords to find services. But when you call and you talk to a resource specialist, they'll know some of the things that Joy was just talking about, so that they'll refer you where you will qualify and hopefully save you a lot of time that way. They also check to see where is funding still available. Sometimes one agency will have already started their waiting list. Another agency may still be able to offer immediate help.
For the healthcare area, there are other avenues of resources available to people, even if the funds, dry up on the United Way's side, because that's where we have a number of partnerships, over 20 partnerships with other nonprofits in the community that can provide access to dental care, that can provide access to behavioral health services and other types of health care. So that's a good part about that.
Before we begin, you were talking a little bit about what the focuses for service area were. I believe you said dental and
Behavioral health.
And so you all are addressing that. Can you tell me a little bit about the steps that you're taking to address that?
Actually, we have been working with the community as a whole. Over the past several years, we've been looking at community health needs assessments, we've been looking at the data, and we've been having conversations with folks in the community. And what we've identified, which many know, is that there is a lack of resources still, even with this program in place. We are a medically underserved area. We are a medical provider shortage area, so we still have a lot of unmet needs. So what we try to do is direct our resources and our efforts in trying to bridge those gaps, to try to link people to the right services, but we try to come up with innovative ways to offer health care in those specific areas. And so we have recently expanded services for dental in the community. We've expanded services for behavioral health in the community. At one point, we only had 2 dental access points, that being Travis Dental and Lakeland Volunteers in Medicine, because we were able to use these funds to secure other state and federal dollars to the community. That helped pay for us to expand services for Central Florida Healthcare, which is a federally qualified health center, as well as the Florida Department of Health. So now they are also providing access to dental services for our population who is low income and who qualify.
And for us, as the steering teams started looking at and advising us, as we do every year, where are the needs shifting and changing in the community, and dental and behavioral health were rising and rising. And behavioral health includes both mental illness and substance abuse. We used to talk about those things separately, and we've grouped them. Then the steering teams trained the community investment teams as they went out on those site visits and read the application. If programs are providing services in either of these areas, then please prioritize them. And so the programs that were providing those services did get increases so that they could help to address the community's issue.
So it sounds like both organizations really were listening to the data and really hoping to improve the situation in our community, in our county, and for United Way, the Tri-County area.
We sure try.
And if I can add, we've got the recent census tells us that there's about 100,000 people in Polk County who are uninsured. We know that there's approximately 57,000 people that may qualify for services through the Indigent health care program. So based on our data from previous years, we can report that there's about 75% of that population that we're serving currently through these funds. So there's definitely a need, and that continues as we work together. We try to make sure we don't provide the same services to the same population, but we can better coordinate what types of services and make sure that people are getting those needs met.
The Annie E. Casey Foundation Kid Count just came out this week, and Florida still ranks, we were 47th at one point, and we rank 40 out of 50 states now, so we've moved up a little bit. There are 16 areas that they look at. We improved in 10, we went down in 6. But the other states are moving faster than we are, so we didn't move up as much as we had hoped that we would. But in the area of kid care health insurance, we did improve, and Success by 6 is an internal program with the United Way of Central Florida, helps to register children for kid care, and we are doing better. We do have more children insured now than we did in 2014 when they last looked at those numbers.
That's fantastic results. I mean, if we're moving in the right direction, we're
Exactly.
not slow and steady wins the race.
Right.
Now, I would love it if we could sort of paint a picture. Do you have a success story that you could share?
Gosh, we have a success story for every one of the 105 partner programs that receive funding. In the area of health, there is one, and I sort of referred to it earlier. This was a person that went to, this particular one was at LVIM, and she was in terrible health as a result of diabetes. She had been through a divorce, lost insurance, and was not using her insulin, and was really pretty close to death. They were able to provide the insulin through the pharmacy program that we helped to fund, and then continue to monitor her care until her blood sugars were normalized. And she is back to work, feeling great, and ready to go on and live her life. So we're certainly grateful that she didn't die, but we're also grateful that she didn't lose her eyesight or have an amputation as a result of an illness that a critical illness, but it can be, or chronic, that can be so easily maintained.
And the thing I like about that story is that she gets to go back to her life, and she's productive, and she's contributing to the local economy. She's just living her life. And
Exactly.
without those services, she may not have been able to do that.
We have those stories in education where kids that were 3 years behind in their language development triple the normal growth with the services they receive from United Way funded programs, and enter kindergarten ready to read. And we have higher promotion rates, better standardized test scores with the children that are in our program. So there's a lot of good news. And one quick one on financial stability. Since 2011, we have increased by 16% the number of low-income families that are now banked with savings accounts of $300 or more. Now, to a lot of us, $300 doesn't sound like much to have in a savings account, but for a low-income family that's never been banked, it saves them over $2,000 a year in fees to cash their paychecks and to pay for money orders, to pay their bills and other things like that. So it's huge. It can be the flat tire repair that gets them to work on time and keeps them from losing their job. So a 15% community-wide impact in the number of low-income families that are banked with savings is something we're really proud of too.
As we should be. I mean, that's tremendous. It's the trickle effect. You never know how it's going to affect you or how it's going to change your whole life.
And those programs also help to improve credentials that get people higher family incomes, and then they qualify for health insurance. So everything is connected. And low-income families, the #1 predictor of student failure in the school system. So if we can stabilize the family income, access jobs that have health insurance combined with the connected as a benefit to the job, the children are going to do better in school. Everything is connected to everything else. We can't silo these services. We have to look at them as
Holistic.
connected and holistic services.
I certainly hope the funds continue to be there for both organizations, and thank you both so much for being here. It's been a pleasure to have you.
We appreciate the opportunity. Thank you.
That's all the time we have for today. You can catch replays of this episode on Mondays, Wednesdays, and Fridays at 10 a.m. and 4 p.m. You can also catch all of our previous episodes on the Polk Government YouTube page. I'm your host, Lauren Lengyel. Thank you for joining me on this month's Picture of Health.